This is the beginning of the infiltration technique with tumescent local anesthesia, and the skin entry points for the infiltration needles are being anesthetized with 1% lidocaine or 1% prilocaine, whichever would be your choice.
So we do multiple little points so we can place the
Needles.
20 gauge needles pain-free. So the actual idea was to administer tumescent local anesthesia without any pain for the patient. So it's like a fog going over the field. Suddenly there is this anesthesia present, and the patient really doesn't know where it comes from. We have a way of using sharp needles instead of an administrative needle, which is used normally in the United States. And as far as I learned, it can be sometimes a little bit painful when you push primarily this cannula forward.
Before we get to the discussion about infiltration cannulas, we'll just mention that the safety of liposuction using tumescent local anesthesia is unprecedented, and when this procedure is done properly, there's never been a fatality that we know of anywhere in the world. So this is truly the safest and best type of liposuction. Now what's happening here is multiple 3-inch 21 gauge needles are being inserted into the subcutaneous fat, and the tumescent local anesthesia, which would be a mixture of prilocaine and lidocaine, is being infiltrated into the fat from multiple areas. And this is a nearly painless way to do it, and this is somewhat different than what we see in the United States with doctors using infiltration cannulas, which can be somewhat more painful. Now, these needles actually spear fat globules and blow them up like balloons, whereas an infiltration cannula can push the fat globules apart, and the anesthesia at times is not nearly as good. And here you see the volume meter in the corner on the LipoSat, which is telling us how much tumescent local anesthesia has been administered. And you can see the areas developing the white blanch, and at the end here you'll see the meter again, and it will show here 1,400 cc's so far, and at the end it's going to be about 8,100 cc's of total volume. So this is done moving these needles around from area to area in order to spear all of the fat globules and get total local anesthesia. Here we're at 3,400 cc's at this point of total volume delivered.
The aim is to have a homogeneous, unique surgical field with no irregularities, so the counter pressure in the subcutaneous tissue is all over the same.
Here we're at 4,000 cc's, so we're about halfway finished with the tumescent local anesthesia. Now it becomes a little difficult to do it in this exact same way in the United States because we have a total lidocaine dose that limits us, so that's why the doctors will use the infiltration cannulas and maybe 1 or 2 needles, but not a dozen needles like this. We're at 7,700 cc's of total volume delivered, so we're very near to the end of the tumescent infiltration.
And now we're here at the end with 8,100, and if we don't really see the blanching in completely, it will be occurring during the penetration time, when the patient waits for the surgery.
So now we wait perhaps 15 or 30 minutes before beginning the liposuction surgery.
That's correct, yeah.